As we all know, submitting a claim to the insurance company is very important for various reasons. The most important is reimbursement. We want to make sure that what we are billing and the services that we are rendering is accurately billed so that we can get paid. Secondly, we want to make sure that we're not billing anything fraudulent. I thought it was important to go over how to submit a claim to Favorite Medical Billing to ensure that everything that is being done by the provider is being captured. I am going to review the obstetric and gynecology form because it has so many moving parts. I just want to make sure that the Superbill is understood so that it will enhance your knowledge and ensure that what you are submitting is the services that were rendered. So you go to favoritemedicalbilling.com, you're going to select the provider portal, submit a claim. The password is in all lowercase with the word purple, P-U-R-P-L-E. Send now. Then you have an option, and as I stated before, we're going to review the obstetrics and gynecology form. Select that, and it will appear. Here, you can add your email address so that a copy of what you submit to Favorite Medical Billing can be emailed to you. You also have the option, once the claim has been submitted, to print what has been sent to Favorite Medical Billing. So if you would like to have an electronic version of what was submitted for your records, then it is important that you put your email address here. The date that you are submitting the claim is important just because I like to make sure and keep track of how long it is taking my company to submit your claims to the insurance company from the time that it is received. Patient's name. The patient's name is the person in which you have rendered care to. In some cases, the care can be provided to both mom and baby, and that information can be submitted on the same claim, whether it's at the time of delivery and initial care, or even postpartum follow-up care. You can put patient as mom here and infant here. If for whatever reason the infant is seen and not the mother, then what you want to do is put the infant's name in the patient section. So the only time when the infant name should be added to the Superbill is when you are billing both mom and infant services together on one Superbill. Otherwise, the infant is its own patient if mother is not being seen. If this is your first time submitting any patient information to Favorite Medical Billing, you want to make sure that you have the patient's address, date of birth. The subscriber information is good, but not always necessary. The policy number, the insurance name, and any authorization. This information is important and required in detail because we will use this section of the patient demographics to add the patient into our system in order to bill claims. Now, if your patient has already done a benefit verification or this is a follow-up claim, then please feel free to just put the patient's name and date of birth. You want to make sure that you always put the provider's name. And the associated facility if you are billing facility claims. If you are just billing a provider claim and there are no facility charges, then by all means, just utilize the provider's name. If you are billing both the provider and the facility name, you want to put both the provider and the facility's information. Now, to begin the review of the Superbill. Evaluation and management or office visit care is care that is either done in an office setting or at home. These are regular sick visits. So if you are visiting mom at home and she has a cold or a yeast infection, this is where you would put that information. Again, also, this is for office visits. So if mom comes in, she has a cold or a yeast infection, then by all means, this is where you would place that information. So if you saw mom on 11/29/15 and she had a cold, you would put cold/sinus infection if you did not have the diagnosis code, or you would put C123.5. So you would place the date next to the service level that you've rendered, whether it is home or office, for any sick visit. You would place the diagnosis, either the diagnosis code or the actual word diagnosis, in the diagnosis field. Well woman exams. These are gynecological exams. If mom comes in, or if a woman comes in and she's a new patient or an established patient within these age ranges, you would place the date that she was seen. Then here for diagnosis, you could click View ICD-10 List. This is a list of ICD-10 codes that are directly related to well woman care. You would want to review this list and choose the well exam diagnosis that fits the care you provided best. So it would be Z01419 for encounter of gynecological exam general. You can highlight that, go back, paste it there. The next section is family planning. So if a woman comes in and she is interested in family planning or contraceptive care, this is where you would place the date of service in which you provided that care. If it was an IUD insertion, if it was a depot shot, if there was a prescription for contraceptive provided, etc. This is where you would place your date of service for the care provided. So let's say a lady comes in, she's interested in the depot shot. You would first communicate with the patient any risk factors in regards to the depot shot, what exactly the depot shot is, how it may or may not affect the body, etc. Then you would select the actual depot medication, and then the use of the syringe. And again, you would go to the View ICD-10. Now, these ICD-10 codes are directly related to family planning. And you would select the one that best illustrate the services in which you have provided which would probably be the Z30013, encounter of initial prescription for injection, or the general counseling and advice. So you would pick whichever one would best fit the services in which you have provided for that day. You can copy it and then paste it on the necessary section. First appointment to confirm pregnancy. This is the appointment not in which the family comes and tours your birth center or interviews you as a midwife. This is the very first appointment that you have with mom, where you discuss any healthcare history, get her last menstrual period date, anything that solidifies that you are gathering this information to confirm pregnancy and you have already been hired, or she has already agreed to establish care to move forward. So you would put that date, and usually the test result is going to be positive so that you can select that one. Ultrasounds. Ultrasounds is not the Doppler. It is not the handheld that you use to listen to the heartbeat at each prenatal visit. This section is for ultrasounds with an ultrasound machine that you use to detect fetal size, sex, growth, etc. You would again select the date that the patient was seen. You have the option to use commonly used ICD-10 codes that have been provided. As before, please read the description and select the ICD-10 code that best fits the care that's being provided for that day, and add it to the diagnosis section. Labor and transferring care. This section is when a mother has received prenatal care from you. You have gone to their home, or they have come to your birth center and they have labored, and they have now been sent home because they are not ready to deliver, their contractions have not progressed, so you send them home. You again choose your dates in which you have serviced your care, and then again use the hyperlink to select the ICD-10 code that best fits the reason why they came in. Labor and delivery, total OB care, home or birth. This section is when the mother has received prenatal care and you have delivered the baby, meaning you have caught the baby and you anticipate postpartum care. This is the total OB code, which encompasses all of those services: prenatal, delivery, and postpartum care. These are other services that can be provided during that time of laboring and delivering. But I do understand that there are so many other things that can go on during that time. I have provided a box where you can add additional notes to make sure that every service that you provide to your client is billed properly to the insurance company. So let's say that mom gives birth on 11/29, you provided the prenatal care, you have done the delivery, you would select the 59400. Maybe she stood in the shower, she sat in the tub for a while as she labored, and let me see, labor time spent with mom was 14 hours. That will be an additional care that I could read. I could possibly request medical records so that I could find the accurate code in which these services can now be billed to the insurance company. Again, you're going to go to your ICD-10 list so that you can properly select the service in which was rendered, which would be encounter of full-term uncomplicated delivery along with single live birth. And add them under the diagnosis section of the Superbill. Labor and delivery transfer of care to hospital or other provider. This section is truly only if you have not, in some shape, form, or fashion, provided entire care to the patient. Either you provided prenatal care and they delivered at the hospital due to a transport, or they decided to transfer to another provider, or say you have a rare occurrence where a patient comes in to interview you, she goes into labor, and you deliver the baby. The most common one would be the 59425 ante 4 through 6 and the 59426 ante 7+. These are the prenatal visits. If you have delivered the baby and provided postpartum, if you have delivered the baby, provided prenatal care, and you are anticipating providing postpartum care, this is not the section for you. The section for total OB care is the section in which you want to utilize to communicate the services that were rendered. Only if there has been a transfer of care, either to the hospital or another provider, you would utilize this section. And again, you would add the date span, this time, for the services that were rendered. So if you saw mom beginning January 1st, 2015, and she transferred on the 15th of March, then here you would put the first date in which you provided care and the last date in which you provided her prenatal care in this box. So again, because this code in this area is for services in which the provider has provided prenatal care, delivered the baby, meaning caught the baby, and anticipate providing postpartum care, this is your section. If you have only provided prenatal care, this is the section that you would utilize. It also gives you the option if you had to transport mom to the hospital, and if you did any follow-up care with her at the hospital, checked her in, etc. This is your section. And again, you would use the hyperlink to select the appropriate ICD-10 list of codes that best fits the services provided. Lactation and postpartum. This is the section for any care that after mom has delivered, that you continue to provide care directly affected to her being postpartum and or lactation. And again, you would select the date for the services that you rendered and select the hyperlink so that you would be able to choose the appropriate ICD-10 code list for this section. Please know and understand if there is an instant where the diagnosis in which you have given to the patient is not on the commonly used list, you may type it in. Whatever it may be. This section is for additional care provided to the mother. If for whatever reason the services, any service that you have provided to mom during her prenatal to postpartum period that does not reflect above, this is your opportunity to type it in here. Let's say mom came in for let's say for follow-up on previous consults on infertility. You could type that in here if you do not have the exact codes for the CPT or the exact diagnosis codes, and then I would again review the information provided, possibly request medical records so that I could make sure that I code the care that you provided accurately. Here is labs and injections. These are medications that may be provided during labor, during prenatal, during postpartum, or just as the patient comes in. Again, you would choose the date in which the service was rendered. This does not have a hyperlink because these services can be attached to so many different diagnosis codes. You only have the option to type in the diagnosis in which you have provided to the patient, and then I would take the word diagnosis and convert it to an ICD-10 code, or if you have the ICD-10 code, you could list it there. Now we move forward to newborn care at the birth center at the time of birth. These would be services that the newborn received from a provider at the birth center at the time that they were born, hence the date of their birth. So there are more than one option that you can choose. By all means, always select as many services as you see on the Superbill for services that you have rendered, and definitely utilize the blank boxes to communicate any services that you have rendered that you do not see. So we would have the initial once over at the birth center, if there were any labs that were done, the discharge of the infant from the birth center, and the use of the room with mother, or if there is a separate room that the infant goes to for the facility. And again, the hyperlink would be available for you to select the best ICD-10 code that would describe the services that were provided. In this case, it would be the Z3800 single live born birth infant vaginally delivered. Now, this next section are basically the same codes, but in the atmosphere of the home. So again, you would select either the newborn time of care at the birth center or newborn time of care at home. You would not select, you should not ever have information here and here, because either the infant was born at the birth center or the infant was born at home. Newborn follow-up care. Now, this is any care that is provided to the mother in postpartum state of the mother after birth for the infant. So if mom comes in and she has questions in regards to postpartum care and you take a look at the baby, those are services that you could provide. You took the baby's blood, did a hearing test, etc. These are all things that are postpartum to the mother and after birth for the infant. And again, a section for any additional services that are not listed in the above areas that you may have provided to the newborn. And again, also a box for additional detailed explanation as you see fit. You click in now. I will receive an email in regards to the services that were rendered. I would use this to bill the claim and submit it to the insurance company, and you have the option then to print the information in which you have submitted to Favorite Medical, or as I showed you before, you can use the option to email the information directly to you. I hope this was helpful. Thank you.